What will happen to Ray when I can no longer take care? I just hope he dies a few minutes before I do. This refrain highlights the anxiety faced by family caregivers, given that adults with intellectual and developmental disabilities most often live with their families, over 70%. And often they outlive their parents. Both parents of adults with IDD and the adults with IDD experience disparities in health status and in income. Nearly 500,000 adults with IDD, 500,000, are on waiting lists for residential supports. Also, many families do not plan for the future, resulting in chaos, emergency placements, and traumatic transitions. Through the research of our previous and current federally funded centers in our Institute on Disability and Human Development, we have not only documented these disparities, but also developed and widely disseminated evidence-based interventions. These interventions are steeped in the notions of self-determination and community inclusion of people with disabilities. One intervention is The Future is Now, which uses peer approaches that are both family-centered and person-centered to help people with intellectual and developmental disabilities and their families plan for the future. Currently, we're testing a total virtual version of this intervention. Adults with IDD have a shorter life expectancy, poorer health status, higher rates of obesity, and earlier age-related changes than the general population. Hence, we developed an exercise and nutrition health promotion intervention called Health Matters. It's individualized to reflect the needs and preferences of the adults, and it builds capacity in the community by working with community-based organizations. These are just a couple examples of ways that our Institute on Disability and Human Development in the Department of Disability and Human Development seeks to break down barriers for people with disabilities. Our institute is one of 67 federally funded university centers of excellence in developmental disabilities, and it's the only one in Illinois. This institute has spawned a full academic program that is a national leader in disability studies. Last year, we had over 2,000 students taking 27 courses from major and minor undergraduate, master's, doctoral, and 4 certificate programs. To illustrate the changes in the field of disabilities and the changes in our building and philosophies of addressing disability, I'm going to tell you about Carlos Drazen, a Black, physically disabled individual who once lived in our building, first known as the Illinois Pediatric Institute, which housed about 100 children. However, a Black neurologist who worked there noticed that Carlos clearly did not belong there, and she moved out, and only to return many years later as a brilliant doctoral student in our PhD in Disability Studies program. She was a leader in the field, one of the first scholars to note the dual oppression and disparities experienced by individuals who were people of color as well as being disabled. The notion of intersectionality, which is just now being discussed in the field, has helped spur the Chicagoland Disabled People of Color Coalition and Grupo Salto. Both of these are groups that the Institute started and sponsors. Now our building is no longer a residential institution, though it still has the vestiges, as it was not built to be an academic center, and certainly not as one that is working to break down barriers for people with disabilities and their families, so that people such as Ray and his family have care plans, and that the Carloses of the world can live full lives in the community.